Woman has been in a coma for 4 years. She was bedridden and inexplicably diagnosed as pregnant. She has not had a period for 3 months. The male carer who was looking after her was a major suspect. The hospital immediately launched an investigation. Her colleagues couldn't believe it. David, who was normally a simple and honest man, had done something so unconscionable behind the scenes. What they didn't know was that David had a long-standing crush on the girl. The girl was a dancer. She practiced every day at the dance. David's attention was always drawn to her beautiful body, so he began to watch her every day from his window, watching her every move. But little by little he became dissatisfied. He began to wish he could talk to her. One day she happened to drop her wallet. He rushed after her and handed it to her, and before he knew how to express his heart, but he said goodbye to her. Unwilling to stop there, David followed her to her doorstep. He found out that her father was a psychiatrist, so he had a plan. He approached her father for psychological advice, lying that he had long been troubled by his sexuality. He began to suspect that he liked boys. The doctor told him to come back the following week for a follow-up appointment. Before he left, David walked into her room unnoticed. He took the hairpin she had left on the table. When he came out, she was shocked and thought he was some kind of pervert. David explained that he was a patient who had come in for a consultation, and left in a hurry, until she heard the nurse say, this man was just a patient who had come in for a consultation. He was also a homosexual. Jean was relieved. David was at the window as usual, watching the dancers downstairs. But the strange thing was, she hadn't come to dance practice for days. It wasn't until she saw her teacher standing downstairs with a serious look on her face. Then he realized something might have happened. David saw her again and found out that she had been in a car accident. She was in a coma and in a vegetative state. There was no telling when she would wake up. Her father was convinced that his daughter would wake up, so he hired the best carers to look after her. And David, with 15 years of experience caring for his paralyzed mother, was given the opportunity. The reason the father was willing to leave his daughter to a male carer, because he recalled that David had seen him. He thought he was a gay man, so he was comfortable with him being his daughter's carer. At first, the father would make unannounced visits to the hospital from time to time, until he saw how well David was taking care of his daughter. He took care of her as if she were his own. In the past 4 years, he had never let up. Only then did he slowly let his guard